It's important to know that while nicotine replacement therapy helps manage withdrawal symptoms, the success of the nicotine replacement therapy depends on the amount used.
When does a smoker start to experience withdrawal symptoms?
The average cigarette contains approximately 10 milligrams of nicotine. The average smoker absorbs anywhere from 1 to 3 milligrams of nicotine from each cigarette. So if you're a 1-pack-a-day smoker, you would consume anywhere from 20 to 60 milligrams a day of nicotine. The magic number is 50%. When a smoker's nicotine levels drop by 50%, they will experience withdrawal. So if you're a 1-pack-a-day smoker and you would start off with 40 milligrams of nicotine, dropping your levels to 20 milligrams could put you in withdrawal. So how much clean nicotine do you need to meet your needs, your daily needs? Would be approximately 21 milligrams of nicotine.
What is the proper way to use the various nicotine replacement therapies?
Nicotine replacement therapy is available in a variety of products: patch, gum, lozenge, and inhaler. The patch is designed to be worn 24 hours. Many clients can't wear it 24 hours. They'll tell you they're experiencing nightmares, vivid dreams, and might have difficulty falling asleep. These clients would remove their patch at bedtime and then reapply first thing in the morning. The problem with reapplying a patch first thing in the morning is it takes 2 hours before the patch begins to work, and its peak effect might take 4 to 6 hours. In that time frame between the time they apply the patch and the time it starts to work, the client could experience cravings, withdrawal symptoms, and might need some added support, perhaps in the form of an oral nicotine replacement product. Okay. If a client removes their patch at night, it's important to note they're not delivering the entire 21 milligram dose to their body. They're actually only delivering about 3/4 of the dose.
How do you use oral nicotine replacement therapies?
Let's talk about oral nicotine replacement therapy. This is the gum, lozenge, and inhaler. In this case, the nicotine is absorbed through the mucous membranes of your gastrointestinal tract. It's not burnt and inhaled through your lungs. So unlike a cigarette, which delivers nicotine in about 7 to 10 seconds to the reward pathway of your brain, oral nicotine replacement therapy products, they don't see an increase in their levels of nicotine for about 15 to 30 minutes, right? It takes that long before the nicotine levels begin to rise. It's important when you're using these products that you use them properly. Nicotine loves a basic environment, so if you include any sort of food or beverage like coffee, tea, pop, you increase the acidity of the environment and nicotine is not as well absorbed. So it's important to consume nothing but water for 15 minutes before or during the time you're using the oral nicotine product. It's important you use the products correctly. With the gum, you need to know how to chew it. You bite down until you feel a peppery or tingly sensation, and then you park it. When you need another puff, you bite down again. When you use the lozenge, you simply move it around your mouth. You park it and then move from site to site to help reduce irritation. And using an inhaler, we always recommend puffing lightly initially to avoid the head rush from getting a mouthful of nicotine.